So, Dr. Zeshan, with OCD, how can we as parents or even caregivers, teachers, create a supportive and understanding environment at home and at school to help our child cope with OCD in an effective way?
I think that's such a good question because it can be very frustrating both for parent and teachers. And I may have given this analogy before, but I just for a reminder because it really helps us understand to build empathy for these children and for these families. Remember, I have give this analogy. If someone had a stroke, and because of that stroke, their right side leg is weak. So that person cannot move the leg. It's not about the want. That person is not lazy, is not unappreciative, is not spoiled. It's just that that person cannot move the leg. Similarly, if someone has a diagnosis of obsessive compulsive disorder, they cannot do certain things. They have to do things in a certain order, in a certain number, because this is not their want territory. So that is one thing I really want people to remember. If they have this germs everywhere, they need to wash their hands. Okay? So if you get up and I have so many time and I feel for the parents, they want kids to be on time in the school. They want them the don't miss out the school. They want to finish the assignment and they have so many other responsibility to do, and the morning is so frustrating and then the evenings are frustrating. Teachers are frustrated because they can see the potential in this child. The child is able to get good grades, but have been missing school, delay in the school, or have been not or been disrupting the class because the child have to move in a certain or in a certain way. So this is something that the parents and the teachers they have that discussion that this is part of the obsessive compulsive disorder and how we can be more supportive. So many times we have this, what you call it in US, we have 504 plan or IEP, individualized educational plan, where we write it down. The child is okay to be late in certain days, or is okay to spend some time in the washroom, or is it okay to have, do things in that order and not penalize to it. The second thing, we talk with the parents and, just like, if someone has a stroke and right side leg, so we provide crutches, we provide small baby step. We don't ask them to do such a big task, you start taking the stairs because these are just a 7-year-old baby child can take the stairs. How can you a 60, 50-year-old, the such a big man with such a big muscle body cannot move because that leg is weak and this is their can territory. So similarly, again, as I said, it can be pretty frustrating, but provide that small, the crutches, how we can be more supportive in that way. And I think there are a lot of great, the therapies, the cognitive behavioral therapy, exposure response prevention, where they can help you and guide you. Because one thing that parents are doing, we call it an enabling behavior, that because of with their good intentions, but they are actually reinforcing that obsessive compulsive behavior in children. So yes, so get professional help when you see your child has been struggling and it is impacting their day-to-day functioning. Get professional help and then be more supportive, be more kind, and also reach out to school as well so that we can work on the 504 plan so that the child also feel well supported in the school as well.
Thank you so much, Dr. Zeshan. As always, so helpful.
Thank you for having me.